information so that we can start our session today. Okay, so I can see myself live. Welcome everybody. Welcome to this session of high-yield MCQs and concepts. This is the fifth session of this month, and this is the fifth YouTube session. And in every YouTube session, we are trying to solve some of the high-yield questions and gather concepts by solving question. For anyone who is attending my session for the first time, I'm Dr. Abhishek, your mentor for biochemistry at Unacademy. And if you are first time onto this channel, onto this YouTube channel, I'll request you to subscribe and hit the bell icon so that not only me, there are more than 40 different educators who come live on this platform on YouTube Unacademy channel. Every month we started around 1.5 years back, and already we have more than 1.4 lakh subscribers, 4 lakh subscribers. So make sure you subscribe and hit the bell icon so that whenever one of us is live, we'll get to know a notification. And primarily we try to cover the latest topic, the clinical questions, the image based questions, previous year question, the high yield questions, so that you are able to revise effectively. And if you have already seen attended few of my sessions, I'd simply request you to give this video a thumbs up. So with this, let's start with the MCQs. Before that, a few announcements from Unacademy end. There are two batches which we have started at Unacademy, the Plus platform. So one is a NEET PG seasons batch. This is primarily for those people who wanted to appear for NEET PG, but because NEET PG has been postponed, so this should not fall out of preparation. So this is a NEET PG seasons batch. For anyone who is planning to take NEET PG next year, this is a next 22 batch. And there is a professional second year batch. For a lot of our students are second year students. So this is a batch which will balance their prof questions as well as their PG questions. So everything will be taught in that phase. A lot of practical aspects will be taught. So this is a professional second year batch. Again, this started just yesterday, so you can get all these access to Unacademy Plus. We'll talk about Unacademy Plus. There was an fmge grant test today. Hope you would have attempted it. So we'll talk about Unacademy Plus subscription in a while. Let's start with our MCQ session. Hi Satyapati, long time. MCQs करा रहे हैं Satyapati. So this is the first question. Take your time and try to answer this question. A 24-year-old female presents to her primary care physician with a complaint of rash that will not go away. The rash presents as patient face in a butterfly distribution sparing nasolabial folds. She easily gets sunburned and thus avoids going to beach with her family. Additionally, she states that she is getting tired more and more easily. Lab study shows elevated anti-nuclear antibodies and anti-double-stranded DNA levels. Further testing also reveals that elevated anti-U1 SNRP is tighter. This reflects an increase in antibodies to the U1 SNRP molecule. The SNRPs are evolved in which critical cellular function? Hi Tina, hi Pragya. So, what is the function in which these SNRPs are involved? So Pragya is saying A. Anyone else wants to answer this question? Now again, as I told you always, that whenever you are reading a clinical question, never read from start, always read the last two lines first. You will have your answers, because here they are just asking a simple question that SNRPs are involved in what critical. So we know that small nuclear ribonuclear proteins are primarily, so it is introns, removal of introns from RNA transcript. Okay, so this is the function of SNRPs. So the correct answer will be A. Any doubt in this question? So this is a very simple question, but this is how they are going to ask you. So don't get confused, or then don't be afraid when they give you a big clinical case. Most of the questions can be answered by reading just the last two lines. Let's answer this question. Hypoxanthine ribonucleotide is called. So what is the ribonucleotide of hypoxanthine called as? Is it called as xanthine monophosphate? Is it called as inosine monophosphate? Is it called as adenosine monophosphate? Or is it called as guanosine monophosphate? Hypoxanthine ribonucleotide is called what? Is it called as xanthosine monophosphate, inosine monophosphate, guanosine monophosphate, or adenosine? So Sutharsan, Vasundhara, Pragya, all of them are saying B. Okay. So hypoxanthine ribonucleotide basically is called as inosine monophosphate. The correct answer here is B. And again, this remember, for example, if the base is nitrogenous base is adenine, the nucleoside will be called as adenosine. And when we add a ribonucleoside, which means when we add a ribose sugar, it will become adenosine monophosphate. Similarly, for guanine, it will become guanosine monophosphate. For xanthine, it will become xanthosine monophosphate. For hypoxanthine, it will become inosine monophosphate. For cytosine, it will become cytidine monophosphate. And for uracil, it will form uridine monophosphate. Okay, this is the ribonucleotide. When we talk about deoxyribonucleotide, remember adenosine will form deoxyadenosine and this will become deoxyadenosine monophosphate. So this is deoxyribonucleotide, not ribonucleotide. So deoxyguanosine monophosphate, deoxycytosine monophosphate, and thymidine is always deoxy. Remember, thymidine is always deoxy. So it will be thymidine monophosphate. So these are very important nucleic acids and their derivative. Let's answer a very similar question. Which of the following is not a nucleoside? Which of the following is not a nucleoside? Let's see who answers this question. So which of the following is not a nucleoside? Is it your adenosine? Is it your cytosine? Is it your guanosine? Or is it your xanthosine? So what is a nucleoside? Nucleoside, if you see, N is for the base, nitrogenous base, okay, and S is for your sugar. So it will have the nitrogenous base and sugar only, whereas nucleotide will have everything. T means all the three. So it will have the base, the sugar, as well as the phosphate. All the three will be there. So we are looking at nitrogenous base and sugar. So adenosine, what is it made up of? It is made up of adenine and sugar, right? Adenine and sugar. What is cytosine? What is cytosine? Cytosine is your nitrogenous base. What will be the corresponding nucleoside? So it will be cytosine plus sugar will be called as cytidine. Okay, it will be called as cytidine. Remember, cytidine. So this is the nitrogenous, nucleoside corresponding to cytosine. Guanosine is again guanine, the nitrogenous place plus sugar, and xanthosine again is inosine plus your sugar. Xanthine plus your sugar. So the correct answer here is this. Cytosine is a nitrogenous base. It is not a nucleoside. Is this clear, all of you? Cytosine is only a nitrogenous base. It is not a nucleoside. When we add a sugar, it will become cytidine, which is a nucleoside. So this cytidine is a nucleoside. Is it clear, all of you? Okay. Let's look at this question. ALU is an example of mini satellite, microsatellite, line, or sign. ALU is an example of mini satellite, microsatellite, line, or sign. So Tina, Sutharsan, Vasundhara, Pragya. ALU is an example of mini satellite, microsatellite, line, or sign. Again, mini satellite, last year there was also a question, mini and microsatellite. 2 years consecutively this question has been asked. Hi Limbu, namaste. So Tina is saying B. Anyone else wants to answer this question? Okay, no problem. Remember, even if you guess, you will learn more. If you don't participate, you will not learn. I always talk about participatory learning. Don't worry about getting it wrong, just participate. The more you participate, the more you will learn. So almost everyone is going for ALU, but that is not the correct answer. The correct answer is sign. Okay. So let me talk to you about this. So around 30% of human genome is a repetitive sequence. Okay. So around 30% of human genome is a repetitive sequence, and they can be called as a highly repetitive sequence, which is seen in the satellite DNA. They can be called as a moderately repetitive sequence, which can be tandem repeat. Tandem repeat, we know it can be a multiple copy of a gene, or mini or microsatellite, which means depending upon how much nucleotide bases are repeated and how total. For example, if 2 to 5 or 6 is repeated for less than 1 kilo base pairs, so it is called as mini satellite. Anything more than 1 kilo base pairs and up to 15 nucleotides, that is called as a microsatellite. So mini and micro depends upon, and these are tandem, which means the repetition is together. If you see the repetition, this is a tandem, which means the repetition is here one by one. Suppose AGT, this trinucleotide is repeated, so it will be AGT, 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 thus this kind of repetition. Okay, so these are called as tandem repeats, where it will happen together. Is it clear what is a tandem repeat? What is a tandem repeat? This is a repetitive segment, and this is what is repeating, and all these segments are joined together. Then we have got something called as interspersed segment, which means the repetition is happening, but they are interspersed, which means one is here, one is here, one is here, one is here. So the repetition is here, but not in tandem. They are not close. They are distributed throughout the genome. So in that we have got sign, that is called a short interspersed nuclear segment, that is ALU is an example. And then we have got line, that is long interspersed nuclear segment. L1 is the example. So ALU, this is one of the most biggest gene. Okay, most here. So this it belongs to the sign category, that is short interspersed. The repetition is short, but it is interspersed. Let's answer this question. Topoisomers are DNA forms that differ in. Topoisomers are DNA forms that differ in GC content, melting temperature, coding region, or linking number. Topoisomers are DNA forms that differ in. So this has to relate with the topoisomerases, which you learn. So Therapy Adda says A. Anyone else? Topoisomers are DNA forms that differ in GC content, melting temperature, coding region, or linking. Kennedy also says A. Vasundhara is saying coding region, C. So what do topoisomerases do? If you remember, they remove the torsional strain. One of the examples is, suppose this is your DNA alpha helix, right? Okay, and if you open this DNA, this DNA is opening. In the direction of the opening, there will be torsional strain, and that torsional strain is basically removed by your topoisomerase. It will cut it, let the strain come out, and then again it will rejoin it. So if you remember this concept, remember, then this torsional strain has nothing to do with the GC content, okay, nothing to do with the region, coding region. So the only possible option can be melting temperature or linking number. The correct answer is linking number. So what is a linking number? Let me show you. So basically, suppose two forms of DNA are there, two segments are there, and they are just joined at one point. So the linking number here will be 1. If they are interjoined at multiple points, let's say in this case 6 points they are joined, so the linking number is 6. So what does DNA basically, this topoisomers differ is they are differing in their linking number. Okay, so basically if this has to be removed, one of the segment has to be cut, then it will be removed, and this topoisomer can be converted into this when the linking number is decreased. So basically topoisomers are different in their linking number. Okay, and topoisomerases are enzymes that change the linking number. So if you have to decrease the supercoil, the linking number has to, so if you have to induce negative supercoil, the linking number will decrease, and if you induce the positive supercoil, if there is more supercoiling, then the linking number will increase. So this is the function of topoisomerase. Now this won't be related to the melting temperature. Melting temperature primarily depends upon the hydrogen bond. No matter how much the linking number is, the amount of hydrogen bond does not change. Is this clear, Pragya? The amount of hydrogen, it's DNA wounding upon its other. The double, this is basically this here the DNA is being wound on its own. Okay, let's answer this question. What should be the pedigree chart? What kind of inheritance pattern it is showing? Just give me 1 minute. There is someone on the sorry. So what is this here? So let's count. One of the easiest ways counting the male and the female. 1, 2, 3, 4, 5 females are affected. Okay, let's look at the male. 1 and 2 males are affected. Is it clear? 1 and 2 males are affected, right? Now, so if the number of female is more than male, what is the first thing which you will rule out? If the number of male is more than the female, what is the first thing you will rule out? What is the first thing you are going to rule out if the number of anyone? X-linked dominant. And what is the pattern for X-linked dominant? What is the pattern for X-linked dominant? What is the pattern? Father will transmit to all the daughter. This is the only confirmatory pattern for X-linked dominant, right? So here if you see, here is your affected father and here is your daughter. So is the daughter being affected? Is the daughter being affected? So this definitely is not X-linked dominant, right? This definitely is not X-linked dominant, right? Now, so we have ruled out X-linked dominant. Now let's see if one of the parents is affected, there is no skipping of generation. One of the parents is affected, One of the parent is affected here. Here there is one of the parent is affected, but the children is not affected. But in most of the cases, affected parents are having affected children. So this is probably a case of autosomal dominant. It cannot be a recessive disease. So let's look at what are the options. It cannot be a recessive disease. Okay? It cannot be a X-linked recessive also, because it's not a recessive trait. It cannot be X-linked dominant because we have seen that the father is not transmitting to the daughter. Okay, this is the only father in the example which is having a daughter. So this definitely is not X-linked dominant. Okay, so this will be an autosomal dominant, even though male and female ratio is skewed. Is this clear to all of you? Why? So this was a little tricky, but if you know the basics, you would have solved this. Let's look at this and try and answer this question. So what is the inheritance pattern in this? What is the inheritance pattern in this? Why it is not recessive? This is a very good question. Remember, in recessive, what happens? Normal patients will, parents will have suddenly an affected child. But here, if you see, it is running in generation. This is called as an exact vertical transmission. This is a exact vertical transmission. Okay, only one generation, in this case only both the children are not affected, but in all the other the children are affected. Okay, so this is more of an autosomal dominant character. Let's look at this, right? Mitochondrial mein all the children will be affected. Mother, all the children will be affected. Let's answer this question. What should be the answer for this? So this is not mitochondrial, because you see, if the mother is affected here, not all the children, this is not affected. So this cannot be mitochondrial, this cannot be Y-linked. Let's count the male and the female. So number of female is 1, 2 and 3. What is the number of male? 1, 2, 3, 4, 5. So when it is male is greater than female, what is the first thing we rule out? What is the first thing we rule out? When the male is greater than female, what is the first thing we rule out? Go to the protocol which I've told you. X-linked recessive, right? So X-linked recessive, what is the pattern? Horse night pattern. From uncle to nephew. From uncle to nephew. And this definitely is a recessive disease. If you see both the parents are not affected, suddenly one of the child is affected. Okay. So this definitely is a recessive trait. The best thing is if both the parents are normal and suddenly there is affected child, it is a recessive trait. And you can see because male is greater than female. Now this is a relatively complicated because even though it is a recessive trait, you are starting with a affected female, which means both the chromosome are X. Okay, both the chromosomes are affected. So that is why, because here both of them are affected, so all the children are affected. Okay, is this clear, all of you? So this is an X-linked recessive transmission. Is this clear? A classical horse night pattern, which means it is from uncle to nephew. Okay, here the both the children parents are only affected. And why it is a recessive trait? Very simple. Even if both the parents are normal, suddenly the child has a never a dominant disease will present like this. If the parents are normal, the children will always be normal. Okay, the children will always be normal if the parents are normal. Right? Let's answer this question. Very good, Vasundhara. Let's answer this question. Can you identify the pedigree chart in this? Can you identify the pedigree chart in this? So this is, so few things what you have to roll. Remember, first, is it mitochondrial? So here is an affected female. Many of the children are not affected. This children is not. So this is not mitochondrial. This is not violent. Immediately count the male and female. Don't waste your time. 1, 2, 3 male, 4 male. And what is the female? 1, 2, 3, 4, 5, 6, 7. So definitely number of female is greater than male. So what is the first thing you will rule out? You will rule out X-linked dominant. So to best rule out is find affected father, see if all the daughters are affected. So this gentleman had 2 daughters, both are affected. Okay. Again, if he's a father, 3 daughters, all are affected. Is this clear? So this is a clear-cut case of X-linked dominant. Any doubt? So remember, the only difference between autosomal dominant and X-linked dominant is looking for a father to daughter transmission. So you are correct, Tina, when you are saying that it is a dominant disorder, you are correct. There is no skipping of generation. Normal parents, all the children are normal. Normal parents, all the children are normal. Normal parents, all the children are normal. So we are looking at a dominant trait. This is very, very clear in this case. But is it X-linked dominant or autosomal dominant? So you have to decide between X-linked dominant and autosomal dominant. X-linked dominant, very easy. Find a father, check all his daughters. Find a father, see all his daughters are affected. So this is an X-linked dominant trait. Is this clear, Tina? Will you be able to now understand this? Yeah. Very good. Let's answer this question. DNA glycosylase is involved in. DNA glycosylase is involved in mismatch repair, base excision repair, nucleotide excision repair, or direct repair. DNA glycosylase is involved in mismatch repair, base excision repair, nucleotide excision repair, or direct repair. So therapy Ada is saying B, Laishram is saying B. Anyone else? Vasundhara is saying mismatch repair A. Anyone else wants to attempt this question? Pragya is saying nucleotide excision repair. Okay. So Vasundhara has changed the option. The correct answer is base excision repair. So glycosylase, okay, it only removes one particular nitrogenous base. So what happens in base excision repair is, let's say, this is a cytosine residue. Okay, and spontaneously the cytosine residues gets changed to uracil. Now we know that uracil cannot exist in DNA, right? So this, you know, glycosylase identifies this and removes this single uracil. It will remove this single uracil, and then DNA ligase 1 and DNA polymerase 1 and ligase will fill this gap. So this is your base excision repair. Is this clear, everybody? So this is your base excision repair. Okay, it happens when there is a spontaneous deamination of cytosine converting into uracil, and we know that uracil can never be in DNA. So this glycosylase keeps on looking for this. If it finds a uracil, it will remove it, that single base, and it will be, filled. So this is base excision repair. Let's answer this question. A 1-year-old male with chronic anemia is found to have beta thalassemia. Genetic analysis shows that one of his beta globulin genes has a mutation that creates a new acceptor site 19 nucleotide upstream of its normal splice acceptor site of the first intron. Which of the following is the best describes the new mRNA molecule that can be produced from this mutant gene? So let's answer this question. Anyone? So let me explain you what is happening here. So this is the exon 1. This is the exon 1. This is the intron 1. And this is the exon 2. Okay. Now normally what happens in splicing? Normally what happens in splicing? There is a nucleophile attack on the 5' except 5' donor end. Okay. And this is cut out. Now this is cut out. Okay. This is exon 2. Now this free end goes and attack here. And this is called as the 3' acceptor site. Okay. But what is happening here is rather than coming here, it is hitting somewhere here. 19 nucleotide upstream here. So rather than hitting here, it is hitting here. So now this will be exon 1. This part of the intron will be included in the final A, and this will be, exon 2, right? Only this portion of the intron will be removed. This 19 nucleotides will be added to the exon 2. So what is happening is exon 2 will be very long. Is this clear? Is this clear, everybody? Once again, let me explain it to you in a very simple way. So first of all, let's understand what is going to happen in a normal splicing. So this is your exon 1. This is your intron 1. Okay. And this is your exon 2, right? Exon 2. Now what happens? First of all, there is a nucleophile attack here, and then this attacks here. This is called as the 5' donor site. Okay, because it is on the 5' end, and this is called as the 3' acceptor site because it is on the 3' end. Okay, this is what is going to happen. But here in this case, what is happening is this attack is not happening at that point. It is happening here. So this 19 nucleotide upstream, this attack is happening. So ultimately the cut will happen here, and in your finer mRNA, this exon 1 will be completely right because the donor site is here. You will have this small segment, and then you will have your exon 2. So exon 1 will be fine. Exon 2 will have this additional part of the nucleotide. So the exon 2 will be very long. Is this clear, all of you? Any doubt? Okay. So now we will talk about a question which Dr. Sonalika GMC Nagpur has asked me, sir, how to make notes. So this is something which I get asked very, very often. Now, frankly speaking, if you are a first, second, third year student, you can think of making a notes. If you are a final year student, if you are an intern, if you are a post intern, forget about notes. You can never make notes because you will start making notes. It is such a tedious process that you will never have time, energy to make completing the notes. So I'm going to suggest something for my intern, post intern. For everyone who is in first, second, third year, they can make their notes. Okay. And even then I will not suggest a lot on making notes. What you should do is pick any review book of your choice. Pick any review book of your choice. Okay. Maybe for anatomy, you are going to pick up Kaushal's book, or for biochemistry, you can pick up a Rebecca James ma'am book. So whatever review book you want, you pick that book. Then what you do is remove all the MCQ pages. Just keep the theory pages. For example, a 600 pages of book, review book, if you remove all the theory pages, what will happen? If you remove all the MCQ pages, it will left be only 200 pages. So what happens after each chapter? Put a blank page, 3 or 4 blank pages, and then get it a spiral bound. So let's say this is the book. Okay, you cut it, you remove all the pages, you remove all the MCQ pages, just left with the theory pages. Put a few blank pages after every chapter, get it a spiral bound. So why I am suggesting is that this 600 pages book looks a lot bulky. This 200 pages book looks very thin. You will feel more confident. And why I am suggesting adding blank pages is whenever you get a new point when you are reading or solving MCQ, you can add that point. So this should become your primary source. Okay. So for every subject, you can pick a review book. You can also take a specific notes of your favorite teacher, or you can pick up any coaching institute note for a particular subject, or what you have already made. So anything, but this is what you should do if you have not made any notes. The only notes which I will suggest is using a stick-ons. So all of you know this is stick-ons. All of you know this stick-ons. So how are you going to use it? So whenever you are reading from your notes or whatever, you use this stick-ons to write the most important points. Okay. Once you write the most important points, stick it on the wall. Let it be there for 7 to 10 days. Now let's say you have collected around 8 to 10 stick-ons on biochemistry. Take a A4 size page, stick those stick-ons on that properly, with the glue stick. Now you will have the most condensed note. If your entire biochemistry is of 200 pages, your stick-on notes will not be more than 20 pages. And these are the most important theory points. You can use it repeatedly to revise. So this is my suggestion will be on how to make notes. Okay. So first, never go for making notes. Always take the review book or notes or whatever is your choice and use it as a base notes. Make sure that you add a few blank pages after every chapter and get it a spiral bound. And second, the only notes I'll suggest is use stick-ons to make notes. And that stick-on can act as a summary notes for you, because at the end, even if 200 pages into, let's say, 12 major subjects, it will become 2400 pages. You cannot revise this amount of pages in the last 10-15 days. But if you make this stick-on notes, it will be 20 into 12. So the entire syllabus can be summarized in 300 to 400 of stick-on pages. And this you can revise it. So this is my suggestion to Sonalika and all of you who are struggling to make notes and thinking, don't waste a lot of time on notes, because you need to revise it and learn it more. Okay, I know it's not the best idea. Ideally, many people love making notes, but that time is gone if you are not in first, second, third year. Okay, so let's talk about the sponsors for this session. Unacademy, where Unacademy you can get live sessions, test discussion, structured course. You also have an access to Prep Ladder under our iconic subscription. You can get Unacademy and Prep Ladder both. These are some of the offers. I mean, I have been on Unacademy for almost 2 years. I've never seen such nice offers on Unacademy. And if you use this discount code Dr. Abhishek 10, you will get a further 10% off. Right? So if you are a first, second, third year, go for a longer duration. If you are going to appear for NEET PG, go for a shorter duration, 1 year. Okay. This is for anyone who wants to go just for 3 months. Then there is an offer for 3+1 offer. And if someone is appearing for next year, then you can get a 12+2. This is all in addition with a 10% discount on Dr. Abhishek 10. Anyways, I would have a lot of other discount coupons also. So if you are planning, hit me on Telegram, hit me on WhatsApp, and I'll see if I have some additional discount coupons. So this is your, Unacademy app. You can use this discount code to get a 10% off. Thank you so much, everybody. We'll again meet next week for discuss more of such questions. Thank you so much. Let me thank everybody who has been part of this session. Satyapati, Tina, Pragya, Suthasran. Then we have got Vasundhara, Limbu, Progress Limbu. Chetan was there. Kennedy, Hemeshwar was there. Okay, Tina. Thank you all. Thank you so much. Okay. Therapy Adda was there. Nawang was there. Thank you so much. Abu Muiz was there. Thank you so much, everybody. Thank you so much for attending this session. Take care. Bye.